Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And that's why we're honored to have with us Laurie Powell, CEO of Alliance Healthcare Services. How are you doing?
Hey, thanks for having me, Jeremy. I'm doing really great. How about you?
Doing well. Well, when you talk about the importance of mental health, this is your world. We're going to talk about collaboration. We're going to talk about expansion and so much more. But let's start with 50 years in terms of the history and legacy. So give us a little bit of background.
Oh, thank you. So Alliance Healthcare Services initially was called Southeast Mental Health Center back in 1974. And community mental health centers were founded based on the Community Mental Health Center Act. And the purpose of that was to bring people out of the institutions into the community that had been living in the state institutes for many years. And so that was a whole focus on community integration and lifting up people with mental health to show they could live successful lives in the community.
We'll talk all about the Crisis Center, but walk us through the different programs, because when you talk about outpatient, addiction help and recovery, like there's a lot for what you do.
Right. We have so many. Just to start with, we started with outpatient back in 74, and then we added housing services in the early 90s. Peer support services were added after that. And then we built the Crisis Stabilization Unit program in 2008. And that included mobile crisis services. Then we added beds to that program for stabilization. Then we added medical detox for those addicted to opiates and alcohol. And then we added some intensive grant programs through community. It's called Certified Community Behavioral Health Clinics, which Alliance is the only one in West Tennessee that has that designation. So that shows that you're meeting outcomes and sending the data in to the federal standards. You're meeting those standards. So we're real excited to have all of these programs. And we have over 500 employees now, and I think we're at about 20 locations, including all of those programs that I mentioned to you.
Talk about the exciting news of the Crisis Center.
Oh, yes. We're really excited about that. So we're going from the second floor of Memphis Mental Health Institute to the 55,000 square foot facility, which is, I know people say state of the art, but when everyone sees the final product, it really is very unique. I traveled across the country with some of my peers to look at how other agencies were doing it, and we really developed something that we thought the community would really be proud of as something that people from all over the country will want to see how we're doing it. It's a one-stop shop, and it will open in January 2025. And it's at 3200 Broad. So people just want to drive by 3200 Broad Avenue. It's that whole corner block with Summer on one side and Broad on the other. And we're so excited about that building and what it's going to do for the community, actually. Yes. Yeah,
as I was saying, and take that right there and run with it, because that's what I was going to ask. Yes. Is when you look at having that sort of facility, obviously 24/7, the opportunities to serve, but talk about the different programs, the opportunities. What will it mean for our community?
Sure. It will mean the ability to serve more people, and children and families will be able to walk into that voluntary walk-in just to get help. There will be an increase in emergency room diversion with our partnership with the Memphis Police Fire Department. Because they'll have their own Sally Port. They'll be drive in, drop off, and get right back into the community. And the police department, that's the Memphis Police, and also the sheriff, with our co-response models, they will be able to do that as well. And if they see something in the community where, hey, that person looks like they're having a mental health crisis, let's take them to Alliance and get them immediate treatment. So for their safety and for the community's safety. So it's really going to take us up a notch for how many we can serve, from 17,000 to 55,000 square feet, from just a couple of waiting room areas to 16 individual patient rooms, just like a psychiatric emergency room. So
what will that mean for you and your team in terms of staffing, training? What will that mean on the leadership side?
sure, we will be hiring. Actually, we have hired a new director of crisis services that actually started today. We will bring probably another 40 positions to the community through that one location. We already have 120 that work out of our current location because it is 24 hours. So we'll continue to develop and add grants and programs as needed based on the community needs.
Dive in deeper on the co-response model, because you are working very tightly in partnership with the Shelby County Sheriff's Office, Memphis
Right.
Police Department. And so from a training, from a standpoint of, like you said, being able to understand what's really taking place and then respond appropriately, dive in deeper on those co-response models.
Sure. Alliance started the co-response model with the Memphis Police Department. CIT is Crisis Intervention Team. That was founded way back in the late 80s. And that is a cutting edge model where the police respond in a humane way to those experiencing a mental health crisis and get them linked to treatment. And so Alliance was funded a grant back in 2017. We started the co-response model with the Memphis Police and Fire Department. What was unique was that we added the fire department role to do a medical clearance piece. So what that looks like is we go out to the community, a call might come through 911, it might come through Alliance, and the team decides we need to go out. This person is maybe not willing to come in voluntarily, perhaps, or the family's worried and the person's not going to get treatment. We'll come out, talk to the family, talk to the person who's experiencing a mental health crisis. And if they need to come to Alliance and get stabilized on medication and treatment, we will do that, or divert to whatever level of care they need. And so the sheriff, Sheriff Bonner, after we implemented that with the city, he wanted to replicate that model, and I met with him and his team. And so that started about a year ago. And the goal is to reduce repeat calls to these law enforcement and fire department, right? And get them linked to treatment so that they can focus on other, emergencies.
You and I were talking before we hit record, and the last time that you were on was during the pandemic or coming out of the pandemic. Mm-hmm. When you look at where we are right now in this moment around this conversation of mental health for children, for families, for adults, obviously the crisis, response, the co-response, model, where are we when you look at mental health right now versus where we were coming out of the pandemic? Where is that for you all in terms of, are you seeing the numbers continue to rise? Like, what does it look like on your end?
Yes, thanks for asking that question. Kids, children and families are really needing our help more than ever now. If you look at the statistics, during COVID and after COVID, the number of kids reaching out, families going to emergency rooms, their kids were expressing suicidal ideation, that's exploded. I think it's double the number that used to go to emergency rooms with mental health crisis pre-2019. And we're seeing those numbers increase. So I have met with people from, for example, Bonner, saying that, hey, we really hope that we can do more for these kids and families that are coming through. So we did respond to a grant for the Children's Crisis Stabilization Unit. There's only one in the state right now. It's in Knoxville. And the Department of Mental Health is funding this operation in Memphis that we will start on building right on that same campus where the adult building is. And we're going to call that campus our Crisis Wellness Campus. Anyone is welcome, regardless of insurance, status, economic status, etc. We want to meet the community's need. And so that is our mission, to promote wellness. And so that's just an extension of that. We knew that we needed a crisis stabilization unit for kids based on what we were hearing from the community. And so That should open about 12 months after the other facility opens, and we're so excited to be able to meet that need. And that will be for ages 4 to 17. And yes, there are children who are age 4 that sometimes are in crisis, and their family doesn't know what to do.
Yeah, it breaks your heart, but it's also nice to know, obviously, that there's an opportunity to have help, obviously, through Alliance Healthcare. So when you talk about kind of where all this, the magic happens and how it happens, and then obviously the end result, you don't have to name any names, but give us kind of what success looks like. So give us a success story or an illustration of, what puts a smile on your face with the work that you're doing.
Sure. I've got so many. I'll start with one of the employees we hired, and there's a video on our website. She came into our addiction treatment unit, was addicted to opiates, fentanyl, and we were able to not only save her life, but get her on the path to recovery, and we ended up hiring her, and she's one of our best peer recovery specialist employees. I mean, that's a success story right there. Another one, a mother sent me a thank you that her baby was taken away because she was bipolar, not stable. And with treatment, she was able to get her baby back. And so these people, they're reaching out for help. They really need our help. And another one that I'll mention to you, like I said, I have probably 100 in my brain. There's a guy that's a student at University of Memphis who was in our first episode psychosis grant program. And that's an intensive wraparound model where they work with that individual to stabilize maybe they're having their first time, they're hearing voices or feeling paranoid. And we work with that individual and their family. And he's getting ready to graduate from University of Memphis now. And I mean, if that's not a success story, I don't know what is, right? And there's lots of people out there that need this type of help.
Yeah, that's awesome. When you look at the work you do for Alliance Healthcare Services, it's a long-term journey, right? Like there's no quick fix over here. It's a process. It's a journey that you're walking alongside someone with. And so talk about that kind of mindset around these sort of challenges in the community, individual, with family, with children. It's a long-term approach. And so talk about kind of that mindset around the longevity, the walk, the journey,
Sure.
that this isn't a sprint.
That's right. Well, it starts with number one, meeting that individual and family where they are, right? I mean, some families might be in denial that this person has a mental health diagnosis. That individual might not realize they need, help. And so we approach it from like a recovery standpoint to say, hey, it's obviously one thing we can agree on is this family's suffering, right? And what can we do to help you along that way? So I like the way you phrase that. Yes, it is a walk with someone on their journey to recovery, and it looks different for different people, for different families and children. And of course, the most important thing is to come from a viewpoint of strength. Every family has strengths, and to work to develop those in relationships. Some people need help with establishing relationships and having a community support. So, for example, the Surgeon General talked about we're in a loneliness epidemic apparently right now. So add that to a mental health crisis, then you've got your loneliness epidemic. I think we're seeing older individuals that are coming to us for help, over 65, that are experiencing depression because they were shut out from COVID, isolated from their families. And so there's so many different people going through, struggle. And that's, you have to approach it from an individual, what does this person need? What can we do to link them to, success? And so there's something called recovery action plan, that clinicians will work with the individual to help them identify what's going to help them. And they can refer back to that. Well, here's what I'm going to do when I start feeling this way.
How can the community help Alliance Healthcare Services?
Well, we just began a foundation. Mark Billingsley is our executive director of our Alliance Foundation, and we're actually going to have community events throughout the year. Our big fundraising breakfast will be coming up in November, and we'll be doing that to just help support all of this work. We do have funding for the buildings, but we will need, help continuing this work and expansion. And so our website is alliance-hs.org, and they can reach out and donate there and come to some of our community events. So we're real excited. This is all new. Our foundation is relatively a working foundation for exactly 1 year now. So this is all new for us, but it's exciting. The growth is exciting. To see the community response to what we're doing is very exciting and positive. So, and we do work with so many different partners that reach out to us. For example, the Union Mission. We did a tour of their facility. They said, hey, can you help us? There's so many people coming in with substance use and mental health issues. And we said we would co-locate there and go to where the need is, not expecting people to always come to us, if that makes sense.
Yeah. Well, I think just like you're talking about, the need is great, but the opportunity is as well. And so when you talk about collaboration, being proactive, innovation, all of these things are really important to be able to help lift our community and those who really are in pain and struggling. And so I greatly appreciate everything you're doing. Wrap up again one more time, because you never can say it enough in the world of media, but where do we go again to learn more about Alliance Healthcare Services?
Go to alliance-hs.org and just look at our client stories. We have videos posted on some of the success stories I mentioned to you, and we're always looking for volunteers as well. So reach out to us and let us know if you're available to volunteer and to donate. That would be great. And as we continue to grow and expand, the community needs us more than ever, because we are serving anybody through any door, regardless of your ability to pay. And that's what our community needs right now.
Yeah. Well, Laurie Powell, CEO of Alliance Healthcare Services, thank you for all you and your amazing team do to power the good. Thank you for coming on the show.
Thank you. Thanks for having me.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.